Visible? All right. So, welcome to this day one of orthopedics. And what I have done here is in this PDF, which is different from previous one, right? That I have clubbed questions here. So, even if you have attempted the previous lectures, I will suggest stick on. It will act as a revision along with how to solve the question. The PDF is in the Cerebellum Telegram group, my friends. All right, it's there. All right. So when we look at orthopedics as a word, right? Telegram link share कर देना तरुण. कर रहे हैं बेटा. Natava, we are doing it, okay? Done. So I hope you people have got it right. So let's start ortho here. Right. Let's go. Right. This is my daughter, and she welcomes you to Cerebellum and to the lectures of orthopedics here. She was age 1 when we clicked it, and look, she how innocent she looks, and that's how the orthopedic questions are. All right, so they look innocent, but they are very naughty and they will trouble you. But if you understand these 2 days, I promise you that most of the questions will be okay to handle. So when I look at this is the first slide I made when I started teaching, and I think that I'm very fortunate that I am interacting with the young brilliant brains of the country who are trying to get one more degree to their name. So my best wishes, and I just want to tell you one thing. If you say you can, and if you say you can't, in either case, you will speak the truth. So start your journey of preparation with a firm belief that you can. So start saying, yes, you can. This is the most important thing any doctor can say. We are hope to many. So let's start saying we can. All right. Now, this is my name. It hardly matters. I help people crack questions. So MCQ, Q is the question. What is important is the choices. We are the combination of the choices that we opt in our life. So if you have read a question and then you have two options and then the four options, you get confused. But one rule that you take away from this message is always read all 19 subjects. Are you okay with this color of the pen? Are you good with it? Good. So read all 19 subjects, revise all 19 subjects. This is the first rule. And the rule number 2, which you should remember, is all options you must read. Never mark an answer without reading all the options. It's very, very important that you develop this habit of reading all the options, because that's the only way you'll be sure that a question which was previously repeated, right? Or a question which is modified on the repetition, you are able to solve it. So it is very important for you to understand. So both the spellings are correct. This slide just means both the spellings are correct. Orthopedics, both are correct. So one with a A or one without a E. I like without the E. That's okay. Both are fantastic. All right. What does this mean? Ortho means straight. Basically, when this branch siphoned out of surgery, right? So it was a branch to correct the deformities in children. All right. So it means straight child, and that's how its emblem is also. It's a deformed tree which is being supported by a wooden stalk. All right. So orthopedics, what does it mean? Straight child. This is number one question that is asked to you guys. Rarely, but when it comes, you should not get it wrong, right? So this is straight child. This term was given by a scientist called as Nicholas Andre. They're not going to ask you this image. Don't believe they're going to ask you this image. They won't. They might ask you this. This is the emblem of orthopedics. Emblem is a crooked tree supported by a wooden stalk. So you're trying to correct a deformity or give a splint to it. All right. So he gave the name orthopedics, Nicholas Andre, started this branch, orthopedics, wrote the first book, and gave the emblem of orthopedics. So he is called as the dear Papa of orthopedics or the father of orthopedics. If they have this question and they have this option of marking it father, you allow it. Reactions on kar do beta. All right. So this is something which is very, very important. Then comes another scientist whose name is H. O. Thomas. Hugh Owen Thomas. H. O. Thomas. So, H. O. Thomas is very, very popular and he is a British. ऐसा कहते थे, it was said that the sun never sets in the British Empire. So Britishers felt that everything they have created. All right. So they said, how can Nicholas Henry be the father? Where was Nicholas Henry from? France. He was a French. How can he be the father? So they came with a saying, हम है पापा सबके. So H.O. Thomas साहब ने बहुत कुछ किया. He did a lot of things. The first thing Thomas साहब did was he gave a splint. Now this splint was made for TB knee. For his wife, he made it. Tuberculosis was not very prevalent in British Empire, in the Britain, in England. But tuberculosis of the knee happened, so he had to make a splint. अपनी बीवी के लिए सब कुछ करना पड़ेगा. So he made this splint. All right. And the rule of splintage is immobilize a joint above and a joint below. So if this is the knee, you have to immobilize the hip and you have to immobilize the ankle. So if I have a forearm splint to given, so I will immobilize my wrist and my elbow. One joint below, one joint above. Right. Then he gave a Thomas test. Thomas test, which is for hip flexion deformities. It is for hip flexion deformity, Thomas test. Again, out of this page, whatever I'm showing you, a very, very commonly asked question is Thomas test, hip flexion deformity. They also have a question, the steps of Thomas test, which we will be doing tomorrow. Right? Then wrench. Orthopedics, they're concerned, orthopedicians are concerned with correcting the deformities. The Thomas wrench, which is given to correct the deformities. And then they gave us cervical collar. Cervical means neck. Cervical collar for the cervical spine injuries. So he gave 5 things: the splint, the test, the wrench, the collar. What is the 5th thing he gave? Anybody? It's a pediatric deformity, commonest pediatric foot deformity. Fantastic. Swati, excellent answer. CTEV shoes. What is other name for CTEV? Club foot, because it looks like club. The golf stick. The stick of golf looks like a club. It's called a club. So club foot. That's how it looks like. Club foot. So CTV shoes were given by Thomas. Are we good? So this is the contribution of Thomas. If you're a final year student, you get a short note on Thomas and you write these 5 things and you get 5 out of 5. All right. Then came the fight, the paternity issue. The paternity issue is between, right, Nicholas Andre and Thomas. So we have 2 papas. Papa 1 is Nicholas Andre. Papa 2 is H.O. Thomas. Okay, bete? So remember that. Now came the point, यहाँ लड़ाई हो गई तो रुकना नहीं है ना, तो आगे बढ़े. अब एक सुप्रीमेसी लानी है. ऑल राइट. फादर ऑफ मॉडर्न ऑर्थोपेडिक्स. सो रॉबर्ट तो मॉडर्न ही होते हैं. तो रॉबर्ट जोन्स, राइट, मॉडर्न ऑर्थोपेडिक्स. आप लड़ रहे हैं, निकोलस एंड्रे, H.O. थॉमस, रॉबर्ट जोन्स इज द फादर ऑफ मॉडर्न ऑर्थोपेडिक्स. NB बोर्ड is asking you a question. Tell the relationship between Thomas and Jones. Swag अलग level का है. It's a different level of swag. Relationship between Thomas and Jones. So Thomas is, right, the uncle of Jones. So Robert Jones is nephew of Thomas. अब आप बताइए, आप समझ रहे हैं ना? What are you fighting against? This is the system you're fighting against. बेटा आप लोग लड़ रहे हो, एग्जाम कब होगा, कौन सी डेट आएगी? Why last year NEET PG was postponed 4 times and changed dates? आपके देश में दिवाली की डेट नहीं पता? और यहाँ पे लड़ाइयाँ नेफ्यू और अंकल की हो रही हैं. सो यू हैव टू अंडरस्टैंड, यू गेट सीरियस. दिस इज सीरियस नीट पीजी एंट्रेंस एग्जाम. प्लीज गेट सीरियस. ध्यान देना बहुत जरूरी है. ऑल राइट, गोइंग टू नेक्स्ट. देन केम the world with developed, the world developed, and they wanted to go for minimally invasive surgeries. So arthro means joint, scopy means looking through a tunnel. Arthroscopy, right? The father is Watanabe, and the most common joint where you do arthroscopy is knee, followed by shoulder. So knee followed by shoulder is the most common joint for arthroscopy. All right, and then comes arthroplasty. Arthro is joint, plasty is replacement. And the father of joint replacement is Chanle. And the most common joint to be replaced in the human body is knee more than hip. Okay, knee is the largest joint in human body, my friends. Remember that. Hip nahi hota. Knee is the largest joint in human body. So just keep this thing in mind. Knee is the largest joint in human body. Remember that. All right, going to next. So, are you people comfortable with the way I am teaching? Are you guys okay with the speed on which I am going? All right, so let's go to the next thing. If you have a bone, all right, if you have a bone, the bone and the X-ray, I have shown a relationship between bone and its X-ray. So you have a bone and you click its X-ray. So the bone is covered at the top by the articular cartilage. On X-ray, you don't mark that. Why? Because cartilage is not seen on X-ray. Father of arthroscopy, here, beta. Watanabe. Ajit sir, father of arthroscopy is Watanabe. Class PDF will be uploaded in the app. Right? Next. So next comes the epiphysis. The epiphysis is the end of a bone. Is the end of a bone. So in our epiphysis, they ask you, can you name a structure which is just in the epiphysis, a tumor which is exclusively seen in the epiphysis? Chondroblastoma. No, beta. Giant cell tumor is not exclusively in the epiphysis. We will talk about it when we talk tumors. More than GCT. Mnemonic is ECG. Epiphysis. Chondroblastoma, giant cell tumor. So chondroblastoma is purely epiphyseal. Giant cell tumor can go till the metaphysis. Okay. Then comes the growth plate or physis, which is responsible for the longitudinal growth of the bone. Again, it's made of cartilage, so you can't see it on the X-rays. X-rays पे खाली जगह दिख रही है. That arrow of physis is open up. Then comes the metaphysis. The metaphysis is a very common area where you see infections and you see tumors. Very common area. And which tumor is very, very common here? The king of tumors, osteosarcoma. Very, very nice. Very nice. Another tumor which can be seen here is simple bone cyst. Another tumor which you can see here is aneurysmal bone cyst. And then comes the diaphysis. And as Jana ma'am teaches us, there are three vowels here. Osteoid, osteoma, adamantinoma. And here comes the question that came in NEET PG 2024. Ewing's sarcoma. So osteoid osteoma, adamantinoma, and Ewing's sarcoma. These are three tumors which are starting with the vowels O, A, and E. All right, which are in the diaphysis. All right, are we good? Also remember one thing which I want you to remember here. Bone is made of type 1 collagen. वन लिखा है उसके अंदर। कार्टुलेज is made of type 2 collagen, लिखा है उसके अंदर, it's mentioned there. Okay, so remember this, something which is very important, and this slide we'll again talk when we talk about bone tumors, but this is very, very, very important. Okay, hyaline cartilage we are talking about. Okay, so this is about cartilage type 2 collagen. All right, can I go ahead now? Are we good? Right. So when we talk about the most vascular zone of the bone, anybody? Which is the most vascular zone of the bone? Where do you have lot and lot of blood supply, and that's why you have lots and lots of osteomyelitis. Metaphysis, Fordia. Very, very correct. Absolutely correct. Right? Next. The longitudinal growth of the bone is affected by fracture of which region of the bone? NEET PG 2024. Presenting to you the latest question from this year. Answer? Very nice. Epiphyseal plate. ये क्वेश्चन आते हैं बेटा एग्जाम में, एंड वी मेक मिस्टेक्स. नाउ दिस इज समथिंग वी शुड नॉट डू. Are we good? Right? Next. Our bone is made of calcium. The calcium hydroxyapatite, that is Ca10, PO46, OH2 minus. This is the salt, the mineral salt of the bone. And then you have 35% the organic component of the bone. All right? In the organic component, type 1 collagen is there. We will talk about it. So when I talk about the bone, the bone structure is calcium hydroxyapatite. एक बार एग्जाम में क्वेश्चन ऐसे भी आया हुआ है. The formula Ca5 PO43 OH minus. So इसका हाफ है. Both are correct. Epiphyseal plate and physis are same akshay. Correct. All right. So this is correct. Both are correct. This is also correct. This is also correct. Remember that. So 65% of the bone is calcium hydroxyapatite. Right? 35% of the bone is matching. Class is not matching with the workbook. निकालना बेटा workbook, जरा एक बार पेज बाय पेज देखते हैं. एक सेकंड देना बेटा, मैं मैच करवाता हूँ. ऐसे मत करो यार. अभी कर रहा हूं मैं. कंबोज साहब और जगदीश साहब, मुझे एक सेकंड दे दीजिए, वर्कबुक निकाल दूंगा. यही वर्कबुक है आपके पास? ऐसे इल्जाम मत दो यार. देखो, बड़े दिल से बनाई हुई किताब है यार. हमने ये वाला पेज कर लिया पहला, जिसके अंदर आर्थ्रोस्कोपी, आर्थ्रोप्लास्टी के पापाज हैं और थॉमस का पूरा एक डब्बा है. अगले पेज पे चलो, वहां पे बोन दिखेगी आपको, और ऊपर 65-35 बना हुआ है, ऊपर पाई चार्ट. उसके सामने जगह है, वो लिखना है बेटा. पेज नंबर 76 ऑफ द वर्कबुक. आर वी ओके? मिला बेटा? हाँ जी, कंबोज साहब एंड नायक साहब, हो गया मैच? नहीं यार देखो, ऐसी बात नहीं, इमोशनल नहीं करना बेटा. देखो ना, हमें क्लैरिफाई करनी है बात. आर वी गुड? ओके, सो नेक्स्ट वी गो टू, right? Next we go to the organic part. The organic component has different divisions. One is the 95% of the matrix and a small proportion of the cells. So there are three cells, okay, which are important. Osteoblast, they will form the bone. Osteocytes, they are the spent osteoblast. These are maximum number of cells. And osteoclast, they are the bone renewing cells. Renewal करेंगे, or they will do remodeling. They will remove the dead bone, invite the osteoblast, come and form the new bone. So that they are responsible for renovation of the bone. All right. So they are very good bones. So osteoclasts are good cells. They are not bad cells. All right. Now this is what the cells are. When you look at the matrix, you have proteoglycans there, which is providing you the compressile strength. And then the proteins, that is collagen proteins, all the non-collagen proteins, which are providing the tensile strength to the bone. So if type 1 collagen is defective, the tensile strength goes away. And if type 1 collagen is defective, there are multiple fractures to a patient. What is that disease called as? Perfect osteogenesis imperfecta. And then you have osteocalcin, bone specific alkaline phosphatase. All these are markers of bone formation. If they are there, it means that the bone is forming. They are the markers of bone formation. Okay. So osteocalcin, bone specific alkaline phosphatase, these are markers of bone formation, which one must remember. Are we good? Again, these are slides which are a little boring, but you will get questions from them, right? All right. Right. If you have a bone which has less mineral content, it is called an immature bone. And the bone which is calcified is a mature bone. All right. There are names osteoid and osteon. So osteoid is an immature bone. Osteon is a mature mineralized bone which has calcification in it. All right. So remember that. Okay. So mineralization defect, or when the osteon. Okay. Previous slide. Please come to it. Okay. So in the mineralization defects like rickets and osteomalacia, osteo means bone, malacia means softening. Its childhood counterpart is rickets. All right. So rickets and osteomalacia, in these disorders, osteon is less. Decrease amount of osteon. Osteon is less. Okay, so osteon amount is less. Remember that. Are we good? When I look at the epiphysis and metaphysis, if this is your epiphysis, this is your epiphyseal plate of physis, and this is your metaphysis. Right? So as you grow, as you keep growing, right? Your physeal plate allows you to grow. But when there's a skeletal maturity, you can't keep on growing. You will become giant. So there is an age where you stop growing. And that's the age where the epiphysis fuses with the metaphysis. And the physis disappear. This is called as age of skeletal maturity. राइट तो हम लोग ऐसे याद रखते हैं गांव में जब बच्चा बड़ा हुआ राइट गांव में जब बच्चा बड़ा हुआ तो माँ बाप कहते हैं अपने कंधों पे घर का बोझ उठाओ अपने घुटनों पर खड़े हो जाओ सो एट अ पर्टिकुलर एज you are good enough to take the responsibility of your family on your shoulder and stand on your knees. All right. So this is the age of maturity. So shoulder and knee. What age do they ask to take responsibility? 18 years. So shoulder, 18 years. Knee, 18 years. And then they say alternate. So shoulder is 18. So elbow is 16. Wrist is 18. 18, 16, 18. These are age of skeletal maturity, ossification of these joints. And lower limbs, knee is 18, so hip and ankle is 16. 16, 18, 16. Again, 18, 16, 18, 16, 18, 16. So that's how you classify 18, 16, 18, 16, 18, 16. So if you remember that, this is called the milking position and this is given to you on page number 76. Are we good? Now, they very commonly ask you that a patient is claiming to be this particular age and you want to prove the other age, what exercise will you do? So just remember this, that the wrist is around 18 and knee is 18. You will be able to get the questions correct. All right. So this is something which is very, very important. ऑलराइट, सो ऐसे भी याद करते हैं, कोहनी मारने की उम्र है 16 साल, सो एल्बो इज 16, सो एल्बो इज 16, राइट, when you try to take pangas with everybody, so elbow is 16. Are we good? Can I go ahead now? Yeah. So this is how the question came. NEET PG 2024, a suspect of sexual assault of 18 years of age claims to be of 16 years. X-ray of which area can confirm the age of the subject? So 18, 16, 18, 16, 18, 16. All right. Answer? Mohan Raj. What's the answer? Are you able to get, beta? So knee and wrist. Thank you, beta. Thank you very much. Good. Each one of you is precious, beta. Each question is precious. Each student is precious. Which of the following investigation is best for estimation of bone and age? So basically, it's a PGI question. It's just not the best. You will have to answer multiple. So ultrasounds are not very useful. We will throw them out. All right. We will go for the radiographs of hand and wrist, which is extremely useful. Vertebra radiograph we don't do. CTs we don't do. So basically, answer एक ही है इसके अंदर. All right. Radiographs of hand and wrist is good to quantify the age group for the skeletal maturity. All right. That's the answer here. Going to next. Name the joint that around ossify around 16. I want you to answer this. Ankle. C. Correct. Knee is 18. No. Hip is correct. Elbow is correct. Wrist is 18. Are we good? ACD, are we good? So do you understand that if you are not careful, you can get even these questions wrong. Many of you marked only A and C. Many of you just marked A, C and E. Some marked ACD. So answer is ACD. Now this is important, that we are careful when we mark it. Okay. So once you are having a question and this is simple to take, because once you know this particular position, this is called as the milking position of human beings. That's how a child is in the mother's womb. So if you know that, this is very difficult to get it wrong. So try to imagine and revise this 18, 16, 18, 16, 18, 16, which is going to be very useful for you. All right. Now we come to different zones. Zone of articular cartilage is the top zone. That's next to the synovial fluid. It is the top zone next to the synovial fluid. That is why it has got a superficial cells for articular cartilage. All right. It has got high amount of water. पानी के पास है ना, synovial fluid के पास है, and high density cartilage cells. दिया तले अंधेरा. That is why zone 2, just next to the top layer, which is fluid filled, is thickest but low amount of cartilage cells. So the thickest has got the lowest amount of cartilage cells. Highest cartilage cells, zone 1. Ekdam se zone 2 is lowest. It is said that water and proteoglycans, they go opposite to each other. Alright. That is why in zone 3, high proteoglycans, low water content. And zone 4, the lowest one, is next to the epiphysis. So it's going to be mineralized, calcified cartilage. All right. So this is something which is very, very important for you people to remember. And whatever is in the blue has been asked to you in the questions. Give me a second. I'll be back with you in a flash. Can I go ahead now, please? Fantastic. So just next to the cartilage, you have epiphysis, and you get questions in epiphysis. All right. Now there's no picture of these zones. Jaslyn, you don't need to know the pictures of these zones. Let your soul be relaxed. Okay. Let's go ahead now. So when I look at epiphysis, the different types of epiphysis, and you need to know only two. The first one is degenerative zone. What do you mean by degenerative zone? When the cartilage get degenerated, all the zones are affected. All the zones are affected. Okay. All right. So epiphysis. So epiphysis, when you have epiphysis, you look at the pressure epiphysis, the joint forming epiphysis. So the head of femur is a pressure epiphysis. The head of humerus is a pressure epiphysis. Anything that forms a joint is a pressure epiphysis. So number one, pressure epiphysis. The second is the traction epiphysis. Next to it, the pull of a muscle. So example, the weight bearing is pressure epiphysis, the head. And the pull of a muscle, the greater trochanter of femur has gluteus medius and minimus. The lesser trochanter of the femur has got iliopsoas. And you get this question many a times. Greater trochanter, gluteus medius and minimus. These are traction epiphyses. Then you have the third one, the aberrant epiphysis. Right? Aberrant epiphysis is something, epiphysis of the distal end of metatarsal. It is some present in some individuals, in some it is absent. So aberrant is not something which is regularly seen in all of us. And then comes the atavistic epiphysis. Atavistic means in animals, this bone is loosely hanging, independent. But in human beings, it comes and attaches to the specific bone. Like example, the coracoid process to the scapula. Pressure means joint forming, beta, around the joint. So it is the first one to come back. So let's understand each one of them specifically. Right? Number one, pressure epiphysis. Summary नहीं बेटा, अभी तो पढ़ाऊंगा बाबू, प्रणव पढ़ाऊंगा. So pressure epiphysis is joint forming epiphysis. It is towards the terminal end of that particular bone. It is weight bearing, like head of humerus, lower end of radius. It's the terminal end of a bone. Traction is away from the joint due to the pull of a muscle, like trochanters of femur and tuberosities of humerus. And here comes a very important question of tuberosities of humerus. Supraspinatus, infraspinatus, teres minor, subscapularis. Right? So this mnemonic is sits. And what I want you to remember is SIT. These goes on greater tuberosity. And the small s goes on subscapularis, goes on lesser tuberosity. Okay. Now, subscapularis, the small s, has also been called as the forgotten tendon of rotator cuff. In the literature, people don't talk about it. On MRI, difficult to pick. On arthroscopy, difficult to pick. Basically, it is separated. It's on the lesser tuberosity. All others are on the greater tuberosity. So the subscapularis is internal rotator of the shoulder, and it will take your hand to the lower back. And when you try to lift it up from the lower back, you are not able to lift it up. It's called as lift off test. ये MCQ आता है बेटा. Lift off test is for, answer is subscapularis. Are we good? So याद रखना small t है बेटा, तो teres minor है, major नहीं mark करना. Don't mark it as major. Small t, teres minor. All right? Are we good? So these are the areas from which the MCQs will come. Pressure is joint forming, traction is next to it, forming the pull of the muscle. Meghna Sadhuji, so supraspinatus, infraspinatus, and teres minor, small t. They go on greater tuberosity, and then subscapularis goes on lesser tuberosity and responsible for the lift-off test. Done? Aberrant epiphysis, anatomical anomaly. आपके अंदर है, मेरे अंदर नहीं होगा. You may have it, I don't have it. I may have it, you don't have it. All right? Two names, head of first metatarsal or base of fifth metacarpal. It has never come as a question. Atavistic, I said, phylogenetically independent but becomes fused in human beings like coracoid process of scapula. And remember, coracoid is something that people love. The examiners, they love to point at coracoid. They can ask you just beneath the clavicle, what do you have? Answer is coracoid. It is something that people love. Remember that. Okay, so atavistic, phylogenetically independent but becomes fused. Are we good? Next. When I look at this image, this is an image that came in this FMG exam on 12th of January 2025. So somebody asked me to repeat. Can that person answer this question, please? It's a pressure epiphysis. Beta joint, है ना? It's at the joint. Okay, so let's keep things simple. Joint, है ना? Intra-articular pressure epiphysis. Are we good? Next. So we have done the epiphysis, we have done the cartilage. Now we go to the zones of growth plate or physis. लो एबरेंट वाला स्लाइड ले लो बेटा. पूछते नहीं है इससे कुछ. Because the traction is due to pull of a muscle. Okay, so it's traction due to pull of a muscle. Okay, Madhumita? So traction epiphysis will be extra-articular, will not be covered with the cartilage. Like trochanters and tuberosity, they are away. Okay? So this is a pressure epiphysis, joint-forming epiphysis. Weight-bearing epiphysis. Done? Next. So growth plate starts from the resting zone towards the epiphysis, reservoir zone, affected in storage disorders like Gauchers. Next to it is a zone under the growth hormone control. Correct, Varun. You are correct. The traction epiphysis is trochanter. Gluteus medius and minimus are the muscle pulling traction. Traction means pull bete. Okay, Varun? Gluteus medius and minimus are the muscles. So it is pulling the greater trochanter. So traction epiphysis. Okay, Varun, can I go ahead, beta? Thank you. So, storage disorder Gauchers. Just next to it is under the control of the growth hormone called as growth zone, proliferative zone. It is affected in dwarfs and giants. Dwarfs and giants. So less growth hormone, dwarf, Laron syndrome. More growth hormone, giants. So proliferative growth affected in, right, in the growth hormone defects. Maturation zone, also called as a zone of hypertrophy. Affected in trauma. That's the area from which the growth plate breaks and the epiphysis separates. This is a question that keeps on coming to you. Very common question. And then the zone of provisional calcification. Affected in mineralization disorder called as rickets. Okay, so rickets will affect the zone of calcification which is towards the metaphysis. Are we good? So when I look at this, this is called as Salter had this classification for epiphyseal injuries in children. So you do this and then we move ahead. Maturation zone is the weakest. The hypertrophy or the maturation zone. M is metaphysis, beta. So zone of reservoir is the Gaucher's disease. After that is the proliferative or the growth zone affected by growth hormones, the growth hormones which affect it. So growth hormone deficiency is called as Laron syndrome. It will have dwarfs and truncal obesity. That's Laron syndrome. Then comes the zone of hypertrophy or maturation. This is the weakest zone. And that is why when there's any traumatic injury, that's the area from which the fractures will occur or the damage to the growth plate occurs. And then the zone of provisional calcification. Yeah, PYQs of INICT should be done for NEET PG. True. Are we good? So epiphysis, then the zone of resting zone, then the growth zone, then you have the Laron syndrome, and the question usually comes from the weakest zone affected in trauma, the maturation of the hypertrophy zone. So let's do the classification that talks about the growth plate injuries in children. So when you see this, can you see this red line? This is going to the zone of maturation or hypertrophy. All right. So zone 1 is a slip of epiphysis. Only slip. That's called as zone type 1 Salter Harris. Type 2, there is a metaphyseal part along with a slip. It's type 2. Zone 3 is a split of epiphysis. Zone 3. Zone 4 is a split of epiphysis with metaphysis. Zone 4. And zone 5. 5. You must learn how to speak. 5 is 5. Physis. All right. So zone 1 is 1. Zone 2 is 2. Zone 3 is 3. Zone 4 is epiphysis with a metaphyseal part. Zone 5 is 5. Physis. All right. So this is how you should remember that. Which is the most common? Type 2. It's called as Thurston Holland sign. Thurston Holland sign. That's type 2. टाइप 5 में ना बेटा फाइसिस क्रश हो जाता है. टाइप 5 क्रशिंग ऑफ फाइसिस. सो ग्रोथ प्लेट ही क्रश हो जाती है पूरी. All the classifications are mild, moderate, severe. So type 5 is the most severe. पूरी ग्रोथ ही चली जाएगी ना. Because we did that. Physis or epiphyseal plate is responsible for the longitudinal growth. Yeah, it will affect the height. If it is on one side, one limb length will be affected. Very correct, Himank. Are we good? Is it good? This mnemonic is good? You will get it correct in your exams. I love you too. Answer? Are you able to get this question correct? C. I am happy. This? Type 4. So metaphyseal part with epiphysis. Type 4. Yeah, all of them go to hypertrophic zone. Correct. Veena, correct. We are on page number 79 now. We're going to talk about the parathyroid hormone action on the bone. Previous MCQ era beta. D here. I have written maturation and hypertrophy is the same. The trauma separates from here and then the epiphysis slips. Okay, Meghna? Done? So we go to this now. Remember that the hormone receptors are present on osteoblast. So parathyroid hormone, PTH, has a hormone receptor on osteoblast. And this PTH will stimulate the osteoblast. It's the weakest beta, Shivani. So blast will release a rank ligand. This rank ligand is a molecule which will go and attach to the rank receptor. When it goes and attaches to the rank receptor, it stimulates the osteoclast. And in physiology, this osteoclast is responsible for bone remodeling. For example, this will be responsible to take away the damaged bone and invite the osteoblast to deposit the new bone, called as renovation or remodeling. This is first level. Second level, if you have parathyroid adenoma, PTH adenoma, and very high amount of PTH is there. This high amount of PTH will release a lot and lot of rank ligand. This lot and lot of rank ligand will stimulate a lot and lot of osteoclast. So high, 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 high osteoclast. When a lot of osteoclast is there, it will cause bone resorption. There will be cyst in the bone called as cystica. It's in the bone. So osteitis cystica. Filled with fibrous tissue, osteitis fibrosa cystica. When there is bleeding in this cyst, blood, it gives it a color called as a brown color. So it's called as brown tumor. Are we good? So basically in physiology, low PTH is there. That PTH will go and stimulate the osteoblast in normal physiology. That will stimulate, release the osteoblast, will release the rank ligand, which will stimulate the osteoclast and will create a harmony between the damage and repair of the bone normally. But when the PTH adenoma is there, hyperparathyroidism will occur, more bone ligand, rank ligand will be released, more osteoclasts will be there, cause resorption of the bone. They will make the bone look hollow. They can make a cyst in the bone called as osteitis fibrosa cystica. When there is bleeding in that, it's called as a brown tumor, which is an intraoperative diagnosis. So this is all about hyper PTH. Can anybody of you write down the clinical features of hyperparathyroidism? Anybody? Clinical features of hyperparathyroidism, बताओ ना. Very good. Newman, very good. Moans. So psychic moans, abdominal groans, renal stones, and bones. Bones में क्या होता है? Lysis. Very good. I am very happy that you people know this. I am very, very happy. Now we come to the next point. Next point is, let's have some drugs which can be utilized to treat such disorders. Let's have some drugs. So one drug is, if there is a lot of bone weakness and you want to directly preserve the bone by inhibiting the osteoclast. Which is that thing that you need to know to inhibit the osteoclast? Name the drug which directly inhibits the osteoclast and useful in osteoporosis, bone weakness disorder, bisphosphonates. They are drug of choice for osteoporosis. All osteoporosis, bisphosphonates are drug of choice. All right. You have one more drug which can be given to inhibit the osteoclast. It is given intranasal, through the intranasal route, calcitonin. Right? It inhibits the osteoclast. So it is a nasal spray. All right. Then you have drugs which can inhibit the rank ligand. In physiology, estrogen. And in disease state like osteoporosis, denosumab. Denosumab is given subcutaneous, 6 monthly, 60 milligram. Goga bhai is mnemonic, Sara S से है. Right? Subcutaneous bisphosphonate. Ankurati bisphosphonate. No doubt about it. अनुकृति, आई एम सॉरी मैंने तुम्हारा नाम गलत बोल दिया, मुझे माफ कर देना, गोली से उड़ा मत देना. अनुकृति बिस्फॉस्फोनेट. Okay, bisphosphonates are drug of choice for all varieties of osteoporosis. Okay, Gudiya, let's go ahead now. When you have drug which is on bone formation, okay, bone formation, so you have low dose PTH, which means 20 micrograms subcutaneous daily. All right. And this drug, also called as teriparatide, some of you are writing like Dr. Neil. This is going to stimulate osteoblast, but will never release rank ligand. It's not going to release because it's very low dose. All right. So this is a drug which works on bone formation. It stimulates the bone formation. Bisphosphonates, calcitonin, denosumab, estrogen, they inhibit the bone resorption. Do you have drugs which act on both the pathways? Strontium. It acts on both the pathways, stimulate the bone formation, and it inhibits the bone resorption. But it is not used. Why? Because of cardiac side effects. Cardiac side effects. Sorry, मेरा हरा दिल है ये, ऐसे लाल होता है. Cardiac side effects. So not used. There is one drug also. Romosozumab, which acts on both the pathway. Right? Can you tell me the side effect that romosozumab can have? And that's only contraindicated in one particular kind of patients. This is the drug which came in India in May 2024. Subcutaneous, monthly. Anybody who can tell me the side effects? Again, cardiac side effect. I don't know why, but it's said that if a drug will act on both the pathways, the bone formation and resorption, it will have cardiac side effects. It is very, very important for one to remember that. All right. Are we good? Somebody mentioned, sir, what is blood and brown tumor? So when you have a cyst in the bone and it has got blood in it, that blood degradation product gives it a color called as a brown tumor. That's in hyperparathyroidism. Okay, bete? So I will just summarize. Somebody said summarize it. Confusing? Parathyroid hormone has a receptor on the osteoblast. When you give PTH, it will stimulate the osteoblast and release the rank ligand in physiology, which will stimulate the rank receptor and will do bone remodeling. Then you follow the blue shades, PTH adenoma, which will have psychic mones, abdominal bones, renal stones, and bones. Will have lot of PTH, stimulate a lot of release of rank ligand, stimulate a lot of receptors, and stimulate a lot of osteoclast. Blue color causing bone resorption. Cyst in the bone called as osteitis, filled with fibrous tissue cystica. When the blood comes in, blood degradation product gives it a brown color, also called as a brown tumor. That's why the word bones. When you have bone softening disorders like osteoporosis, you have drugs that stimulate the bone formation like low dose PTH, 20 micrograms subcutaneous daily, or you have drugs that inhibit the resorption. And the number one drug which is there is bisphosphonate, which is drug of choice for any type of osteoporosis. Then you have calcitonin, which will be given intranasal. Then you have estrogen and denosumab, which inhibits the rank ligand. Out of it, denosumab is given subcutaneous 6 monthly, 60 milligrams. You have drugs that act on both the pathways. There are two of them. Strontium, cardiac side effects, withdrawn. Romosumab, cardiac side effects, not used in cardiac patients. Subcutaneous, monthly, both acts on stimulation and inhibition. Are we good? Muskan, are we good? The bisphosphonates, beta, on their prolonged use, have a rare side effect, hip fractures. So, कई बार एक question आता है, patient has been on bisphosphonates for long and there's a fracture, there's a pain in the hip. What will you do? X-ray. Can you tell me a side effect of teriparatides? These drugs are for osteoporosis, Rajat. You're correct. Yeah. So teriparatides can lead to osteosarcomas. Are we good? Can I go ahead now? Yeah. So there are different types of joints. So now we are on page number 8080. I have given you a complete table of joints where you need to know, right? And here it's very important for you to remember the ball and socket joint, and there a name called as talocalcaneonavicular. Talocalcaneonavicular joint. Very, very important for you to remember. Hip and shoulder, we all know. Remember, if you do abduction of your shoulders, all right, and you do external rotation, these are the movements which tells you that the shoulder and the hip are good. So two movements which tell you that the shoulder and hip are normal are abduction, internal rotation. So in other words, the internal rotation of the hip is the first movement lost when there is a hip disorder. You ask the patient to lie down and you flex the knee. As you move the leg out, the hip goes in. This is internal rotation. And opposite of this, as you move the leg in, the hip goes out. It's external rotation. All right. So internal rotation and external rotation. These are two movements which are there. All right. Are we good? Most important movement is internal rotation. Remember that. Most important is internal rotation. They have shown you this image multiple times. Next time also they will ask you internal rotation. They will not change to external rotation. So जो आया है वही आएगा. Remember that. जब हमको ये समझ आएगा तब हमारा नंबर आएगा. There are questions asked to me from the duration of use of drugs. Okay, so I will just write it on this page. Low dose PTH, 2 years. Denosumab 10 years, 20 injections. Bisphosphonates 5 years. Drug holiday for one, another 5 years. So this is something which is there. All right. Are we good? Can I go ahead now? Right. So then comes a movement. The first movement in human body is हाँ बोलो, हाँ बोलो, हो जाएगा, पास होंगे, टॉप करेंगे, अपनी मर्जी की ब्रांच लेंगे, अपनी मर्जी के कॉलेज में जाएंगे. So the first movement is yes. So atlanto-occipital joint, the first movement is yes. Atlanto-axial joint, the second movement in the body between the second joint is no. All right. So remember that. Yes and no. All right. Manoj sir, are we good? Yeah. Answer. Left to right movement of the skull occurs at which joint? Atlanto-axial joint. Thank you. ऐसे क्वेश्चन एग्जाम में गलत नहीं करना बेटा. When we look at an X-ray, in X-ray you see the bone in the center. So you can see bone in the center. Our bone has a cortex and has a marrow. कौन सी स्लाइड ये वाली बेटा? Yeah. So we have cortex and a marrow. Break in the cortex is called as a fracture. And marrow is the area जहां पे सारी diseases हैं. So it is the marrow which is diseased. Yeah. So we are in cerebellum. Why are you showing these emojis? Okay. So medullary cavity has diseases. Okay. Right. Cortex break is called as a fracture. All right. Out of that, out of this is a muscle layer. This is a fascia layer, deep fascia. This is a fat layer. These are called as soft tissue planes. Soft tissue planes. So whenever there is a swelling, the muscle and the fat plane, they will merge into each other, called as loss of soft tissue planes. It is very important for us to know the soft tissue planes. For example, if there is very high pressure beneath the deep fascia, called as compartment syndrome, you need to release the skin, the superficial fascia, the fascia, and the deep fascia to decompress the muscle. If you will not release the deep fascia, then the muscular layer will not get its vascularity and will not breathe. So it's very important to do fasciotomy. And till fasciotomy, you release till the deep fascia. So in fasciotomy, release till deep fascia. It's very, very important. All right. So these are X-ray findings. When I further go, I have to remember this is something called a joint space. This is a space of cartilage. And cartilage is radiolucent. Okay. So when there is a reduced joint space, it means cartilage is getting destroyed. It means arthritis. So we remember in bone, we can in X-ray, we can see the cortex, fracture, marrow, diseases, soft tissue planes. Loss of soft tissue plane, infection हुआ, osteomyelitis, the muscle and fat layer merge into each other, occurs after 24 hours. And the cartilage is not seen, that is joint space is not a space, it's the space occupied by cartilage, and reduced joint space means cartilage damage, arthritis. Are we good? Sometimes they can just show you an X-ray and ask you, what are you seeing here? So you see a glass piece here. Why glass piece? Because it's coated with lead. Lead. Lead is radio opaque, so you can see. So X-ray is usually the first investigation in my subject. So, कुछ भी होगा, सबसे पहले you will get an X-ray done. Next, this is an X-ray of which joint? The largest joint in human body, the knee joint. So dear friends, we all know that this is knee joint. Which is this bone? Tibia. Which is this bone? Fibula. Which structure goes here? Common peroneal nerve. Brilliant. And its palsy will cause you foot drop. So you have to take a high stepping gait. Foot drop. Right. Which is this bone here? Patella. Femur नहीं है बेटा. Femur यहाँ mark करेंगे. And this came in the exam. They had marked patella and people marked something else. So they have to learn to pick up patella here. All right. This is the medial joint space. This is the lateral joint space. Medial joint space reduced. Osteoarthritis. The distal part, ये knee है. The distal part to the knee goes towards the midline. When the distal part to the knee goes toward the midline, it's called as varum. Knee is genu. Genu means bend. So knee bends. Genu, knee. Varus, distal part towards the midline, varus. Away from the midline, valgus. Similarly, elbow is cubitus. Distal to the elbow, they go in the midline, cubitus varus. Away, valgus. So if I remember this image, I have genu varum, both the sides. Genu varum, I can make an O. You see it in osteoarthritis or genu valgum, rheumatoid arthritis. You can write an R in between, O or R. पहल दिखाएगा मैं क्या हूं. You can just see. Are we good? O and R. Are we good? So पैर में valgus है. You can see foot deformities also in an RA. Are we good? Break in the cortex is fracture. In infections of the bone, loss of soft tissue planes are seen earlier. That is after 24 hours of osteomyelitis. Then the periosteal reaction. We will come to periosteal reaction, which is seen on 7th to 10th day. We will talk about what is periosteal reaction later. Tuberculosis, there is loss of curvature of spine. See here, our spine has, genu valgum is RA, correct, Mohan Raj? Genu valgum is RA, right? We go to tuberculosis of the loss, tuberculosis of the spine. So let's look at the curvature of spine. The cervical spine goes in, andar jata hai, it goes in. So cervical lordosis, thoracic spine comes out, thoracic kyphosis. So cervical spine goes in, beta, andar jata hai. Thoracic comes out. So cervical है ना ये, goes in. Thoracic पीछे से बाहर होता है. Lumbar goes in. So cervical spine goes in, thoracic comes out, thoracic kyphosis, lumbar lordosis. These are normal curvatures. When we do spine tomorrow at the first session, we will talk about it. But these are the curvatures of spine. Cervical lordosis, thoracic kyphosis, lumbar lordosis. When there is tuberculosis, there will be infection, spasm of the muscle causing loss of curvature of spine. So tuberculosis causes loss of curvature of spine, which is earlier than the reduced disc space. This space is between two vertebrae, so it reduces this space. And joint space is cartilage, which is not seen on X-rays. And reduced joint space means arthritis. Are we good? Please note it down. I'll just come back in a flash. I'll take a 1 minute break. All right, and come back. 1 minute. Stay with me. जाना नहीं मुझे छोड़ के. Sorry, I had gone to get a coffee. All right. Okay, so this is done. Next. All right, this is shoulder. This is the ball and socket joint. Remember that the head of humerus is the ball. 4 times the size of the socket, which is the glenoid. 4:1. It's called as a golf ball on a tee. Tee golf ball का stand होता है. Golf ball. The ratio between the two is 4:1. That's why it's the most common joint to dislocate. All right. And then the highest bony landmark on an X-ray is clavicle. Highest landmark, clavicle. Acromion नहीं होता. You can see acromion नीचे है ना बेटा. And this is what? Coracoid. This is something that is asked to you in the exams. Coracoid है. Okay, bete? This is very, very important for you to remember. Shivani, आपके क्वेश्चन का आंसर osteomyelitis marrow infection. Loss of soft tissue, does it occur when the infection travels out? Does it happen within 24? No, after 24 hours when the infection settles. Okay, A is acromion बेटा. मुझे लगी रहा था वेदिका कोई पूछेगा. A is acromion. Acromion होता है बेटा यहाँ पे ना, acromioclavicular joint होता है. Okay. All right, so these are the labeled images. मैंने दी रखी हैं आपको सारी. Okay, Gudiya, can I go ahead now? These are the process. Okay, again, what you just asked me. Nice. This is again the same thing, multiple slides. No, ऐसा नहीं है. It's not, you should have known that. We all are learning. We are all the students of medical science. Every doubt has a value in my class. मुझसे नहीं पूछोगे तो किससे पूछोगे? We are all a family, okay? We are all learning together. So, you know, we are as good as you and you are as good as us. So let's do it together, okay? हमें सबको मिलके, it's not your exam alone. हम सबका exam है, okay? Let's study. Elbow joint, right? Olecranon. Radial head. Its images and fractures are shown many a times. The first one to come in the elbow is capitulum. सबसे ज्यादा इस पे arrow मारते हैं. They will ask you what is capitulum. All right. Trochlea. Medial epicondyle. Lateral epicondyle. Also called as internal or external epicondyles respectively. Age of appearance of these centers. So capitulum appears at 2 years of age. Radial head, 4 years. Internal epicondyle, medial epicondyle, 6 years. Trochlea, 8 years. Olecranon, 10 years. External epicondyle or lateral epicondyle, 12 years. 2, 4, 6, 8, 10, 12. All right. Okay, so this is something which is clear. No abnormality. Normal X-ray every day. Next. Coming to, are we good? हो गया बेटा ये? चलें आगे? Wrist joint. Radiocarpal joint. अल्ना का बहुत रोल नहीं होता यहाँ पे. Which bone sleeps on it? Like a boat. Most common carpal bone to fracture. Scaphoid. Which is the bone which looks like Chanda Mama? Moon. Lunate. Where does it look like a Chanda Mama? On the lateral view. Remember, thumb in human beings is anterior. Yeah, because we do opposition with thumb. So it's anterior. आगे होता है thumb. So when you see the lateral X-rays, remember thumb आगे है. So you know where the bones have displaced. When we'll talk about fractures tomorrow, we will talk about this. Are we good? This is very, very important for you to remember, right? Which is the largest carpal bone? Capitate. Okay, so there's a mnemonic. When we entered MBBS, it taught us, she looks too pretty. Try to catch her. Try to catch whom? She. So the first row, the total of 3 bones is the age of ossification of pisiform, which is the last one to come in carpal bones. So S looks like 5. So descending order 5, 4, 3. Total कितना हुआ बेटे? 12. And trapezium and trapezoid, they look at she. So they are 5, 5. Total of the second row is equal to pisiform. That is 12. So capitate is 1, hamate is 1. Which is the first one to ossify, bete? C for carpal, C for capitate. First one to ossify and the largest carpal bone. पहला प्यार है और सबसे बड़ा भी है. Okay. So the first to ossify and the largest carpal bone. All right. So 5 years is scaphoid, 4 years is lunate. Triquetrum is 3 years. Pisiform is total of 3, 12 years. Trapezium is 5. Trapezoid is 5. Capitate is first. right? First one to come in the largest carpal bone and then is hamate in the first year of life. Okay, Achal? Yes, Arvind, correct. It was the order of appearance, correct. Right. When I look at the pelvis, I have to remember two things in the pelvis. The sacroiliac joint and its inflammation, sacroiliitis. Anybody, sacroiliitis is a diagnostic feature of ankylosing spondylitis. So they will ask you two questions here. Young man, bilateral hand pain. Young man, low backache. Or sorry, we again repeat. Young female, bilateral hand pain. Young female, bilateral hand pain, morning stiffness. RA. Young female, bilateral hand pain, morning stiffness, RA. Young man, low backache, reduced lumbar functions. So young man, low backache, reduced lumbar movements, decreased chest expansion, red eye redness, heel pain, HLA-B27 positive, ankylosing spondylitis. Remember that. These are two statements. इनमें से एक तो एग्जाम में आएगा ही आएगा. All right. The second thing that you should remember is that the upper end of femur and the pubic rami, they make an arch. They make an arch. All right. This is called as Shenton's arch. So if there is anything wrong that is happening to the pubic rami, to the joint per se, or to the neck of femur, there is a break in the Shenton's arch. It is very, very important. It is break in the Shenton's arch. Right? Next. This is sacroiliitis, inflamed sacroiliitis. Ankylosing spondylitis, HLA-B27 positive. Okay. All right, beta. This is something they have highlighted. When I look at, now we are at page number 82. Page number 82. Some important X-ray views. Some important X-ray views like von Rosen views. Okay. So we will talk about ankylosing spondylitis and arthritis tomorrow. So don't worry about what is red eye means, that it means the anterior uveitis, what is enthesitis. We'll talk about this when we do ankylosing spondylitis tomorrow. Okay, Shrishti? So we have to just focus here that when we look at the RA is very simple. Bilateral hand pain, morning stiffness. Young female, bilateral hand pain, morning stiffness is rheumatoid arthritis. Chetan Yadav. RA means rheumatoid arthritis, bete. Okay. So one man works on one area. For example, if I am a knee surgeon, I work on knee. All right. So when I chose my branch, I decided that I'll go for knee because majority of the diseases in India are knee diseases in orthopedics. So you have to look at the local demand also before you choose what you want to do. Von Rosen was a man who worked on his life on DDH. What is DDH? DDH means developmental dysplasia of hip. So what is there? You have a head of femur and you have an acetabulum. If your acetabulum is flat or shallow, your head is unstable. That's called as DDH, also called as congenital dislocation of hip. So von Rosen was a man who gave von Rosen splint for DDH, von Rosen view for DDH. So this is DDH, von Rosen view. What is the pathology? What is the pathology in DDH? Shallow acetabulum. So they have shallow acetabulum. The cervical means the neck, and the thorax, the dorsal spine, their junction is overlapped by shoulder. So if you want to see their X-rays, cervicothoracic junction, you will ask the patient to be tilted like a swimmer and then you click the x-rays. This is called as swimmer's view for the cervicothoracic junction. So swimmer's view for cervicothoracic junction. All right, very, very important for you to remember. Okay, next. When I look at the acetabulum is a 3D structure. So it is very difficult to pick up the specific areas of acetabulum. So we will rotate the pelvis, take an X-ray. Again, rotate the pelvis, take an X-ray to see different parts of the acetabulum. This is called by a scientist called as Judet, who throughout his life worked on acetabulum. Judet view, acetabulum. Judet approach, acetabulum. Judet classification, acetabulum. So when the Judet word comes, think about acetabulum. All right, so different parts. Then your teeth cannot let you look at the AP view or the front view of your upper cervical spine. So what do you have? Open mouth view. So you open the mouth, and take an X-ray, and there you see the odontoid. So open mouth view, O for open mouth, O for odontoid. So it's for odontoid. So open mouth view is for odontoid. That's how you see it. Okay, so open mouth view, odontoid. All right. And then comes the Shenton's arch we have already discussed about it. Okay, which is the arch of the upper end of femur and the pubic rami. Teeth are not gone, you open so that you pass the X-rays to the mouth. Okay, Aman. So आपने क्या किया? You open the mouth and X-rays go from inside. So teeth are not occluding or blocking your view for the cervical spine. Swimmer's view is just trying to take away the shoulders. All right. So that you do not have an overlap of the shoulders over the cervical spine. Broaden's view is something which is done for the subtalar joints. All right. But is not to be remembered much. X-rays will show you cortex and marrow, will show you soft tissue planes, will not show you cartilage. But then there's an investigation. All right, Von Rosen beta. It's given on page number 82 of your book and the PDF, Von Rosen view. All right, it's already given. Von Rosen. So C for cortex and C for calcification. CT scan. C for cortex, C for calcification. That is for CT scan. Are we good? So C for cortex, C for calcification. It's for CT scan. An MRI. All right. An MRI will be something which will show you more. So in your bones, you have cortex and you have marrow. So when you want to look at the marrow, it's the MRI. And that's why most of the diseases I told you are in the marrow. And that's why MRI is a very, very important investigation. My subject, it can show you the marrow. Also, you should remember that if I look at this vertebrae, these are marrows, this is cartilage. Fibrocartilage makes the disc. That's picked up on MRI. So cartilage is not picked on X-ray, not picked on CT, is picked up on MRI. And then all the soft tissues are again MRI. So MRI can pick up almost everything except the cortex. All right. So this is why MRI is a very, very important investigation in orthopedic. Ligaments are soft tissues, beta. MRI. So ortho में पहला investigation X-ray है. समझना है तो MRI mark कर देना, दिमाग नहीं लगाना. So the first is X-ray. If not, next investigation after X-ray is MRI. That's how it goes. All right. So that's how you should remember. Different MRI के views होते हैं और X-ray के views होते हैं. Sagittal plane divides the body into left, right, transverse into superior, inferior, or the coronal plane into anterior, posterior. Different MRIs पूछ सकते हैं. कई बार तो they just ask you which MRI is there. So they will show you a knee MRI, sagittal view knee MRI. This is a question that came. So you can see there is patella here. All right, and you know this area, pre-patellar area. When this FMG exam this time, right, there was a lot of inflammation in the pre-patellar area. All right, and there were a lot of pre-patellar inflammation. So they had shown you in FMG this 12th of January And you had to ask, this was pre-patellar area. All right. So this is sagittal view knee MRI. So this is femur, tibia. If you look here, this is anterior cruciate ligament, ACL, goes anteriorly on the tibia. PCL goes posteriorly on the tibia. So ACL, yeah, housemaid knee. Dr. Maheshwari, correct, you're correct. We'll talk about it tomorrow. बट बेटा एग्जाम में आया था इस बार एफएमजी में, उन्होंने एमआरआई दिखा के बोला प्री पेटलर एरिया में बहुत सारा सूजन है, वाइट वाइट दिख रहा है. So when you have ACL, it does not allow your tibia to go ahead. It holds your tibia. It doesn't allow the tibia to go ahead. Anterior translation of tibia को रोकता है, पकड़ता है. So ACL restricts hyperextension, that is tibia going ahead, and internal rotation of the leg. Whereas PCL, posterior cruciate ligament, restricts external rotation. So they are crossed inside the knee. Anterior is ahead on the tibia, posterior is ahead behind on the tibia. Right? I drink only 2 coffees every day. Okay, Manoj? 2 coffee every day. Okay? Are you okay with that? Right? We go ahead now. It's anterior on tibia, posterior on tibia, because on femur you can see both are coming out posteriorly. All right. So CT scan is white. सफेद दिखेगा, calcified है. MRI suppressed दिखेगा, gray to dark. All right. Going ahead. There are 2 types of images on MRI, T1 and T2, and this will be covered by Dr. Zainab ma'am in the class which will subsequently follow after from 29th and 30th. So you will be covering this T1 and T2, right? So T1, I just want you to grossly remember, T1 is an image of MRI. First prof subject hota hai anatomy. So T1 will show me anatomy. I want to see whether my shoulder supraspinatus is very good. T1 image में देख लिया. T2 सेकेंड प्रॉफ का सब्जेक्ट होता है पैथोलॉजी. अब ये जो सुप्रास्पाइनेटस है, वेदर इज डैमेज और नॉट डैमेज, पैथोलॉजिकल डिजीज, T2 image, T1 and T2. So these are images of MRI. That's all. I don't want to go further into it. All right. Going further, when I look at somebody who's got weak bones and he just tries to do extra work, and there are 2 types of injuries. One is a stress fracture, one is a pathological fracture. Stress fracture means you give more force to a normal bone. Pathological fracture means normal force to a weakened bone. So in cases of stress fractures, you have a normal bone and repeated force. In such cases, the cortex does not break. It is just the marrow on MRI picks up the changes. That is why for stress fractures, right, the investigation of choice is MRI. They'll give you a long history. Remember, fracture is break in the cortex. In stress fracture, the marrow compresses. The cortex does not break early, not able to pick up. All right. When you have any investigation to look at the entire skeleton, you want to see the entire skeleton. What in the entire skeleton? The osteoblastic activity. So wherever there is a fracture, all right, yeah, it's a pseudonym. Where there is a fracture, the osteoblast will come and repair. If there's an infection, osteoblast will come and repair. If there's a malignancy which is osteoblastic metastasis like prostate, the osteoblast will be positive there. So bone scan can pick up the osteoblastic activity. Wherever it's more blackish, it means more osteoblastic activity is there. All right. Book में है बेटा. अभी बात करते हैं साइदा. Book में है, मैं आपको दिखाता हूँ अभी कहाँ पर है. बस डायरेक्शन अलग है, पेज अलग है. Okay, we'll just do it. Okay. So we have osteoblastic activity. Bone scan can pick up a fracture, can pick up infections, and also can pick up the osteoblastic metastasis. So when I look at, this is how the aggressiveness of the bone scan will pick up. So in stress fracture, overall, the investigation is MRI. Unilateral is MRI. Bilateral stress fractures, investigation is bone scan. So this is given on page number 83. In the center, you will find it. Stress fractures, overall, MRI. Right? Unilateral, MRI. B for bilateral, B for bone scan. Are we cool? Mila Saida ji? It's all same beta. एक पेज ऊपर एक पेज नीचे होगा, सारे नोट्स, क्विक रिवीजन, मेन नोट्स and mission notes are almost synchronized, and you'll find it in the same sequence. The chapters also in the same sequence. Okay, गुस्सा नहीं करना. Okay, so ये मिल गया आपको stress fractures. Now I said that your bone scan can pick up osteoblastic metastasis. बेटा bilateral MRI, bilateral या multiple की बात हो रही है, so you can scan the whole body. Anshul, with one bone scan you can scan the whole body, so you can pick it up. You can't keep on doing MRIs of every area. All right, then comes investigation of choice for stress fracture. Which one will you choose? MRI. Cool. If they would have mentioned bilateral, then bone scan. If they don't mention, MRI. So I said for osteoblastic mets, you will have bone scan. But if you want to talk about metastasis in a little bit specificity, you need to pick up the tumor cells. And tumor cells have got anaerobic metabolism also. So you give deoxyglucose to the patient and label it with radioactive fluorine. And the tumor cell will pick it up. So this is PET scan. So PET scan is better for tumor cells. And beautiful, again, the same page 83, you will have single mets is MRI, multiple is PET scan, and osteoblastic mets is going to be bone scan. Right? Bone scan. Why bone scan? Because it is the PET scan is negative in cases of multiple osteoblastic mets. All right, done. Next, this image. Six-year-old boy complains of pain over his leg, swelling over the shin, and fever. What will you diagnose it to be? Osteomyelitis. So now this is what I want to say. Pain, fever, and swelling in a limb can be seen in malignancies and infection both. The two malignancies, like osteosarcoma and Ewing sarcoma, they mimic osteomyelitis maximum. Both are metaphyseal, means infections and tumors. Although Ewing's is diaphyseal, but infections and tumors are metaphyseal, further confusing you. So if you have pain, fever, swelling in a limb, take tissue diagnosis. Get an X-ray, get an MRI, but do a tissue diagnosis. Divide the tissue into two parts. Send one part for culture sensitivity to grow the organism. If it's infection, the organism will grow. The second part, send for histopath and you will grow the tumor cells. So differentiated by tissue diagnosis, culture for infection, histopathology for tumor. And the line is culture all biopsies, biopsy all culture. This is something you should remember. So टुकड़े की जांच सबसे ऊपर होती है. So if I look at the flow chart on page number 82, it is written there in orange color in the center in the flow chart. Infection and tumor, do a biopsy. Culture for infection, histopathology for tumor. This is what it says. So remember that this is the flow chart. Infection and tumor, do a biopsy. Culture will show you infection. Histopath will show you tumor. They're divided into two parts. So here comes your very, very important point here. Page number 83, right? We have musculoskeletal system. First investigation. Anybody? MRI. So X-ray. The next investigation is MRI. The best investigation is biopsy or tissue diagnosis. Biopsy is the gold standard. Remember that. Radiology is suggestive. मेरे साथ बोलो. Radiology is suggestive. Tissue is diagnostic. Radiology is suggestive. Tissue is diagnostic. Radiology is suggestive. Tissue is diagnostic. ये बेटा पेज नंबर 82 का फ्लो चार्ट है कृष्णा. Done. Good. Next. So this is one thing which you have to see on the bottom of the page. Order in which, page number 82 bottom. Order in which investigations become positive in osteomyelitis. MRI within 12 hours. Bone scan 12 to 24 hours. X-rays, loss of soft tissue planes more than 24 hours. Most important investigation for bone tumors is MRI. CT scan. Anybody? Which tumor will you do CT scan? Osteoid osteoma. Why? Because it's in the cortex. No, Bonini. It's in the cortex. Okay, it's in the cortex. So you can see cortex very well on CT scan. And the last line, DDH. Developmental dysplasia of hip. Screening tool of hip instability. Here's the ultrasound. And for DDH, and otherwise for diagnosis is MRI. And in ultrasound, there's a question that comes. मुझे इसके बारे में आगे नहीं पता, पीछे नहीं पता. I don't want to know more and less about it. Alpha angle decreases on ultrasound. So alpha angle decreases on ultrasound in DDH. मुझे ना बीटा पता ना अल्फा पता, बस मुझे पता है ये क्वेश्चन आता है और ये क्वेश्चन मुझको आना चाहिए. दिस इज व्हाट आई नो. कहीं कहीं पर वी हैव टू अंडरस्टैंड दैट एंट्रेंस इज नॉट अबाउट नॉलेज, इट्स अबाउट द आर्ट एंड स्किल फॉर एमसीक्यू प्रैक्टिस. सो दिस इज व्हाट इज देयर. कहीं कहीं पर मींस रुकना आना चाहिए. मेजॉरिटी ऑफ द थिंग्स यू नीड टू हैव कॉन्सेप्ट्स, but then some places you need to move ahead. All right. Okay, bete? Good. I know that you people want a break. We will just have a short break shortly. Okay, don't worry about it. Can you tell me the answer? Which is not useful for evaluation of osteomyelitis? X-rays are, cultures are, MRI are, bone scan are. So the answer here is CT scan. Although it's also used, but it's the least important. Okay. Next. DDH, we have done this. Screening tool for hip instability. Anybody? Answer. Ultrasonography. Good. So when you are doing a biopsy of a patient, right, bone biopsy, remember that you will always make a vertical incision, longitudinal incision. You won't never make a transverse incision. Why transverse? Because you want to avoid the neurovascular status. You can go through the muscle but not touch the nerves on the vessel. Von Rosen is just a view for DDH beta, nothing else. You don't want to know anything else about it. Von Rosen was a scientist who worked on DDH. It's an X-ray. Okay, Saida? Nothing more you need to know, beta. Von Rosen, throughout his life, worked on DDH. That's it. Right. So, whenever you're doing it, first an X-ray and MRI should be done. Why? So that you can localize the periphery. Because in the center, right, in the center is necrotic tissue. So you want to take it from the periphery of radiological imaging, right? Round hole or oval hole should be made. Square hole will have a stress riser. So don't make a square hole because that will cause stress riser and will cause fractures. Don't do that. Make a round or oval hole. And you take out the sample to the multiple sites. Remember that. You don't take out samples from one side, you take out from the multiple sites. That's the bone biopsy point. Okay? Bone and soft tissues. So never ever touch the nerve or the vessel. Neurovascular should never be touched, Vedika. You must always take out away from the neurovascular structures. Okay? Biopsy is the most important thing to be done to diagnose tumors or infections. Question, which is correct for biopsy? Always periphery, you will have the normal tissue and the disease, so you can get a sample of both. Always done by transverse, wrong. Two different planes, correct. Before investigation, wrong. Periphery and not from necrotic, C. So B and D are correct. I don't know why, but whenever such questions are there in AIMS, B and D are correct. मुझको नहीं पता क्यों, but that's how it is. B and D are correct. Okay, that's what usually they give you. Okay, what is to be done next? Biopsy. You can see a lytic lesion going till the end of a bone. What will you do? Biopsy. Next. Biopsy. All right. Next. Whenever I look at a joint, the first investigation, even in a joint, will be an X-ray. After the X-ray, the next investigation will be an MRI. And after that, if you are suspecting any infection, aspirate the fluid, sulfur cultures, sulfur fluid analysis. And if it's a trauma, do an arthroscopy. And whenever you do an aspiration, it should be done by ultrasound guidance. So aspiration should be done by ultrasound guidance. This is very, very important. X-ray, MRI, aspiration, and arthroscopy. And arthroscopy most commonly is done for two joints. We did that. Knee followed by shoulder. Order is X mass. X-ray, MRI, aspiration, oblique arthroscopy. Cool. So joints, do an X-ray, fill with cartilage, get an MRI done. If it's infected, aspirate. If it's traumatic, go with the scope. When you have stress fractures, more force on a normal bone. It most commonly involves the lower limb, the march fracture, involving the metatarsal neck second more than the third. In upper limbs, it's olecranon, very common. In the spine, we'll talk about it. This is a weak area of spine called as pars interarticularis. It's a junction between the two articular processes, the superior and the inferior articular process of the L5 vertebra. And the treatment of a stress fracture is give a cast to the patient and let it rest. It's also called as a shin splint when it involves the tibial anterior surface. Neck. Dr. O'Neill, it's neck. That's why I have mentioned neck. It's not the shaft. So it's metatarsal neck, second more than third. Okay, this is what you need to mark. Whatever in my PPT is marked in the red in the center, it means there's a controversy. Why will I mark it red? क्योंकि मुझे पता है कि दुनिया में शाफ्ट दिया हुआ है. ओके बेटे, इसीलिए यहाँ पे कलर किया हुआ है ताकि भूलना मत. रेड अलर्ट, जाग जाओ. ओके, गाना है ना, जागे हैं कुछ देर के लिए, अब हमें सोने दो. तो उल्टा है, यहाँ पे सोए हैं कुछ देर के लिए, अब हमें जागने दो. Okay, so young marathon runner is participating in a marathon competition. After running for just 100 meters, he developed pain at the anteromedial aspect of tibia, which was mild to start, right? But increased on further running. X-ray was normal. Doctor ordered a bone scan. What's the diagnosis? Shin splint. अगर इसमें stress fracture होता तो क्या mark करते आप? एक option stress fracture भी होता है. What would you choose? If there was an option of a stress fracture also, then also shin splint, because they have mentioned that anteromedial aspect of tibia is involved. So they have mentioned this. So the answer is going to be shin splint only. Okay, clear kiya hua. Periosteum has two layers. The fibrous layer is a thicker outer structural layer. Functionally, the cellular layer is the cambium layer. It helps the bone to unite, like in the neck of femur. Last question again. देख लो बेटा. Shin splint just means the stress fracture of the tibia. नाम है shin, मतलब एंट्रोमीडियल एस्पेक्ट टिबिया को शिन बोलते हैं बेटा. व्हेन यू टच इट, वहां पे तो स्किन वगैरह कुछ नहीं होती, डायरेक्टली बोन अंडर स्किन. तो उसके अंदर स्प्लिंट, स्प्लिंट मतलब टुकड़े हो जाना, हल्के हल्के क्रैक होना. ट्रीटमेंट इज रेस्ट एंड कास्ट बेटा, और कुछ नहीं है. कास्ट एंड रेस्ट. Okay, so periosteum cellular layer is helpful for the bone to unite. In the upper end of femur, that is neck of femur, the cambium layer is absent. That is why neck of femur is called as non-union on day one. It won't unite because the cellular layer is not there. It will not inherently is not there. Na aap mein hai na mere andar. No one has it. Okay. Similarly, whenever a disease will irritate the periosteum, the periosteum is a sensitive structure. It will announce to the world, I am getting destroyed. This is called as periosteal reaction. Periosteal reaction, when it's narrow into an area, it indicates benign disease. When it's towards outside, indicates wide area or malignant disease or any chronic process. Or sometimes this periosteum can give birth to the tumors like osteochondroma and osteosarcoma. So when you're treating such tumors, remove the periosteum. If you don't remove the periosteum, reoccurrence ho jayega. In a tumor, the rule is remove the whole tumor and remove the cell of origin. It's very important. Okay, so this is about the periosteum. There's a box given to be written about the periosteum. It is one of the contributing factor, Anshul. Cambium layer is a cellular layer responsible for the activities of the bone and union. If it's not there, like in neck of femur, non-union will occur. Yes, neck of femur undergoes non-union, bete. So strain supreme, yes. Deepak, I'm going to give you a break. Just have to complete this small part. I'm done, bete. I will immediately step. You can just see this class will be till 11:30 at least. Fibrous is the outer layer of periosteum. All right. So when there is a cambium layer, cellular layer, this layer is responsible for turnover. High turnover can lead on to the metaplasia, anaplasia, and bone tumors can arise. That's why the cambium layer can give origin to bone tumor like osteochondroma and osteosarcoma. All right. वो lecture recorded है सर्वोत्तम. So bone tumors can arise from periosteum. Correct, Veena. So solid periosteal reaction, single layer of periosteum called as solid reaction, seen in osteomyelitis, and it will come on day 7 to day 10. Okay. Wide area of activity, multiple layers coming out, called as onion peel. Multiple rays come out. Sun ray. Triangular piece underneath the periosteum. Codman's triangle. So these are the three periosteal reactions. Solid single layer, benign tumors. Day 7 to day 10. Onion peel. Codman's triangle or sun ray appearance. So, for example, sun ray appearance can be seen in any malignant lesion, any chronic process, but usually osteosarcoma. Right? Codman's triangle can be seen in any malignant tumor, chronic process, but usually osteosarcoma. Thickened cortex, any malignant tumor, but usually onion peel appearance is even sarcoma. That's usual appearance. They can be anywhere, but usually. So that's how you are asked this question. Answer, none of the above. Because diagnostic तो biopsy होती है ना बेटे. Radiology is suggestive, tissue is diagnostic. Okay, so that's how the questions, ये होता है boom question. फोड़ा, फोड़ दिया, गेम खत्म। यहां गलती नहीं होनी चाहिए, बहुत इंपॉर्टेंट है, गलती नहीं होनी चाहिए। ओके, आप लोग बेटा इस पॉइंट से परेशान है ना, आपकी आत्मा तड़प रही है, ये इस पे बात करें। पेरियोस्टियम की दो लेयर, आउटर स्ट्रक्चरल लेयर, फाइब्रस लेयर फंक्शनल नहीं होती, द इनर कैम्बियम लेयर। अगर किसी के अंदर ये कैम्बियम लेयर बहुत एक्टिव हो जाती है, इट बिकम्स हाइपर एक्टिव, so it can lead to anaplasia, metaplasia here, and lot of bone tumors can arise from it. Two such tumors are osteochondroma and osteosarcoma that come from the cambium layer of periosteum. So when you are treating it, you need to remove the periosteum. अगर आपने छोड़ दिया, it will come back. Are you understanding? This is what bone tumor means. Arises from the cambium layer. Coming next. आगे बढ़ते हैं बेटे। नहीं, वो सजेस्टिव बात ही नहीं है ना, जब बेटा क्वेश्चन नहीं है आप बनाओगे नहीं क्वेश्चन, ऐसे नहीं करो। When the question says diagnostic question can't be modified. Okay, अंशुल बेटा, सजेस्टिव तो किसी के लिए भी हो सकता है ना, मेलिग्नेंट, इविंग, ऑस्टियो, किसी के लिए भी हो सकता है। क्वेश्चन की वैल्यू यही है दैट इट इज डायग्नोस्टिक पूछा गया है। सो सनरे अपीयरेंस एंड कॉडमन्स ट्रायंगल ऑस्टियोसार्कोमा बट कैन बी सीन इन एनी मेलिग्नेंट लीजन। अनियन पील अपीयरेंस इविंग्स बट एनी मेलिग्नेंट और क्रॉनिक ऑस्टियोमाइटिस। सोप बबल अपीयरेंस giant cell tumor more than adamantinoma. पैची कैल्सिफिकेशन कहीं कहीं पर है, राइट, दिस इज पैची कैल्सिफिकेशन। कार्टिलेजिनस ट्यूमर्स, उसमें भी कार्टिलेजिनस मैलिग्नेंट मोर देन कार्टिलेजिनस बिनाइन, एंड होमोजेनस कैल्सिफिकेशन, दिस इज होमोजेनस यूनिफॉर्मली कैल्सिफाइड ऑस्टियोसार्कोमा। वेरी इंपॉर्टेंट टेबल गिवन एट द बॉटम, एंड एक लाइन देखिए ग्रीन में दी हुई है, कैल्सिफिकेशंस कार्टिलेजिनस मोर देन ऑस्टियोजेनिक, रिमेंबर दैट, दैट्स व्हाई 4 इज बिफोर 5। कार्टिलेजिनस ट्यूमर है, डिफरेंट पैटर्न्स ऑफ कैल्सिफिकेशन, वर्ल्स, रिंग्स, अलग अलग पैटर्न होंगे। ओके, सो दैट्स व्हाट द कैल्सिफिकेशन इज देयर इन कार्टिलेजिनस ट्यूमर्स। So bubble is the bone expanded like a bubble and breaking it out. So here it is, so bubble appearance. A tumor which can go till the end of a bone. Remember, tumors, they respect the joint, they respect the cartilage. Infections, they eat both the joint and the cartilage. The only tumor which can go till the joint is the joint. So giant can go till the joint. Remember that. Giant cell tumor. In fact, Robin says it can go and eat the cartilage also. In fact, GCT loves to eat the bone so much it destroys it totally. Also remember one more dictum. Tumor of lower end of radius is GCT till proved otherwise. No, chondroblastoma cannot go till joint, Dr. Neil. So tumor that can go right at the lower end of radius till the joint is GCT till proved otherwise. TPO, till proved otherwise. All right. Sunray is a periosteal reaction. It's a periosteal reaction. We all know that. Answer? Osteosarcoma. Correct. Next. So thin, thick, solid, irregular. These are narrow zones. Sunray appearance, Codman's triangle, onion peel. These are wide zones. Aggressive reactions. Okay. So solid, thin, thick, irregular are narrow zones of periosteal reactions. Let's take a break. It's 7:17. We will start at 7:30. And our class and the lunch break and the dinner break will be at 9 o'clock. Okay? Right. Thank you.